Morning, April 8, 2025. I'm Dr. Duke Majan, CEO and founder of Duke Spine Institute. We're broadcasting live spine surgery. Our patient travels from Nevada. She has 3 discs in her lower back that are problematic, and she has a spondylolisthesis, a slippage of L4 and L5. In the end, she's suffering with debilitating back pain, and it goes down into both legs. We'll be going from both sides to fix the leg symptoms, and we'll be cleaning and repairing the tear in the back of the discs at L3-4, L4-5, L5-S1, 3 discs in order to get rid of her back pain. So we're going to fix leg symptoms by unpinching nerves that's due to stenosis from the herniated disc. We're going to get rid of her back pain. We're going to leave her spondylolisthesis alone because spondylolisthesis does not cause symptoms. All these surgeons are showing patients their MRIs saying your bones are slipping, you need a fusion, but you don't need a fusion. In the future, nobody will be fusing spondylolisthesis unless it's grade 3 or 4, but grade 1 and 2 does not need to be treated. She has a grade 2, 1 to 2, right on the border. She's got about 30% slip. All right, if you have questions, feel free to ask. In the meantime, I'm going to get started. We start by placing needles into the herniation through the skin on both sides. Are we ready, Dr. B? All right, feel free to ask questions. Now, Henry, if there's no questions, why don't you start by showing our audience the video on the 30 different causes of back pain.
Of course.
I'm Dr. R. Duke Majan with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic sciatic pain down their legs with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Majan. Thanks for joining us. Welcome back. You can see from our video that there are 30 different causes of back pain, and this patient has an incredibly complicated, even though she's thin, she's had back surgery before, she has an incredibly complicated spine for me to get into. If you look in the back there, she's got a tremendous amount of arthritis affecting her facet joints. And I'm trying to get around those, shot. And it's a lot harder than I expected, basically, because those facet joints are so full of arthritis, they're literally preventing me from getting into the spine, which is incredible. I did not expect that. Jordan, can you fix, let's see, I think we're okay. I think I just need to be a little bit more lateral at L4-5, just because of her curvature and her facet arthritis. She is certainly not an easy case. Shot. What? No deeper. I don't need her deeper. I don't need her deeper. Shot. I want her awake, if anything. Shot. More awake, as long as she lays still. AP, let's see where we are there. Yeah, we're pretty lateral. And that's okay. It's not terrible. But I'm going to be working on this for a little while. So if you have questions, feel free to ask them.
We have a question coming from Faisal on Facebook.
AP. Yes, Faisal.
Asking, doctor, do you repair discs in the thoracic spine?
Yes, we do thoracic disc repair as well. All right. Interesting. Shot. Shot. Yeah, there's a massive amount of bone here. Shot. From her prior surgery. Shot. 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 AP. That's looking a lot better right there. I'm happier with that. I've sort of taken it to the limit of what I can do in terms of trajectory. And I'm hitting against the bone right there, Sean. I'm going to have to adjust my positioning just a little bit, Sean. Shot. Shot. All right. Have really a lot of bone here. Shot. Shot. That should be good. Let's get an AP. I'm actually going to have to make 2 incisions on the right, most likely, because I can't get the 2 needles to come together at the skin. That looks good there. The 5-1 is the one I'm a little concerned about. I'll need her more awake for that one, but not yet. All right. Okay. All right, let's see. Let me just see. Let me have that, please. Let me probably make an incision here for that L3-4. Shot. Shot. There's something on the back of my ear here. What do you see there? Was it the string? Yeah. Thanks. Shot. Let's get an AP. So she should be an easy case getting into her spine because she's very thin, but she's not. She's a level 10. She's made it very, very difficult because of, you can see the curvature, you can see the arthritis of the facets. They've literally taken a very easy approach with the needle and made it very, very difficult shot. But some luck will get there. AP. You can see the spondylolisthesis at L4-5, the bone slipping. Once again, a lot of surgeons would say you need to fuse, but the truth is you don't need to fuse. Fusion is not good. You don't want a fusion unless you absolutely need it, and there's no reason to do it with a spondylolisthesis when the disc is the problem. All right, so we're good on one side, except for 5-1, which I need her more awake for. And we're going to go ahead and go to the other side and do 3-4-4-5. The curve is a little bit different on this side, so we'll see how it plays out. Okay, we'll start with the 4-5. Any questions, Shot?
At this moment, no current questions. So in the meantime, why don't we show the audience of how it is herniated disc cause back pain and how it is that we cure it.
I like that. Thanks, Henry.
Of course.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922. Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Shot. All right, welcome back. You can see from our video that the disc, which is the #1 cause of back pain in the world, becomes injured, Shot. And then with that injury, it becomes very painful. And that's what we're here to fix. Just want to check something here. I'm going to test the position of this needle. Make sure it's properly in the disc, Shot. Good. Put the needle back. We're going to start with the right side. You think she's responsive enough?
Hello, how are you? You doing okay? Open your eyes for me. Good. I'm
Pen.
gonna ask you some questions, okay? You all right?
So she has 3 discs that we're repairing today. L3-4, L4-5, L5-S1. And she has 2 problems. One is back pain coming from these 3 discs, which bothers her tremendously. The other one is pinched nerves. The nerves come down from the spinal cord and they go down and exit these holes on the side called foramen. That's the same area that I'm coming in with the needle. And I'm going to unpinch these nerves as they exit the foramen. There's 3 on the right side that are being pinched and 2 on the left side. These are called nerve roots, and they're what's responsible for sciatic type symptoms: weakness in the legs, numbness, tingling, and pain. So we're going to kill 2 birds with 1 stone. We're going to unpinch the nerve roots where they exit behind the disc where they're being pinched, causing symptoms, and we're going to clean the tears with a laser so her disc will seal and heal and the back pain will go away. All right. She ready? Is she reliable?
Can you open your eyes for me? Good. We're gonna ask you some questions.
Are you having any
You
pain?
have any back pain now? Yes or no? Any pain right now? Can you open your eyes a little bit for me? Good. You have any back pain now? Yes or no?
Are you having any pain? Are you having any pain?
Any back pain right now? Are you having any back pain? Can you open your eyes?
What is she on, propofol?
Open your
All
eyes for
right.
me.
Well, Jordan, let's see what you can do at 5-1. It looks like the pedicles are not quite lined up. I want to see if we can get those a little bit better. Remember, she's had back surgery. She had it done years ago, and the surgeons did a foraminotomy, laminectomies, which really didn't do her any favors because, unfortunately, can you move the fluoro north? Unfortunately, it's created this cascade of problems down the road, which I think that looks pretty good, right, Jordan? What do you think at 5-1? Yeah? I'm pretty happy with that. Pedicles are lined up nicely. It looks like we're on the right orbital lateral shot. Basically, by doing an invasive procedure she had done at Laser Spine Institute, which is a company that's now defunct, it's closed, went out of business about 5 years ago. Laser Spine Institute would just do a discectomy. They did a microdiscectomy. They cut and drilled and removed bones and ligaments and tried to get the pressure off the nerves in the foramen. But by doing that, they destabilized her spine. And look at her facet joints. They're really sclerotic. Show us the sclerotic facets. Is she ready?
Open your eyes for me.
Those are the sclerotic facets. They're dark. Look, show us the normal facets. 2 up. 1 more up. Go to the right there. That's a facet. See how light it is? That's normal. It's not sclerotic. It's not reinforced. But these are dark because there's a lot of abnormal movement happening there from her prior surgery and the listhesis. And that's caused the bones to get thick and dense. And that's why they're darker on the x-ray. It's not a normal finding. It's abnormal. It's just an indication there's some instability there. She ready? Are you awake?
Open your eyes for me. Good. Good. We're going to ask you something.
Are you having any pain?
Yes or no?
You having any pain?
Yes, say yes or no, okay?
Where do you feel that? Where do you feel that, AP? 5-1 is the one that I'm trying to get into. Very difficult because of the amount of scar tissue there. And I want her awake, yeah. I'm on her more awake right now.
Open
Are
your
you
eyes
having
for
any
me.
pain?
Good. You have
Sean?
any back pain?
Sean, is that it? Any pain? Yeah, she's acting like it. AP, I don't know if this needle is being forced laterally. I think it is. Let's see the MRI, Jordan, when you get a chance, or Nikki actually. Show me the 5-1. See, that looks like we're in the disc. I'm going to do a quick discogram at 5-1 and see if we're in the disc. If we're in the disc, then we'll stay. If we're not, we're taking it out. Are you awake?
How are you doing? You okay? Open your eyes. Good.
Sean,
Ask you some questions. You having any back pain?
show me 5-1
Yes
better.
or no?
Sean? Yeah, it looks like we're in the disc. AP? There's the tear. She's not having any pain. Good. Yeah. All right. We need her awake just for a little bit more. Why don't we just do an AP view while we're here? We're going to test the other discs. She's still a little sleepy. Are you awake?
You doing okay? Good.
Are you comfortable?
Any pain? You having any pain right now? No.
How bad is that? Sean? How bad is that? On a scale of 1 to 10.
1 to 10. What was the number? 8? 8.
All right. How about that? Look at all that dye leaking out. That's
That
unbelievable.
was a 10.
That was a 10. So we had an 8 at 4.5, a 10 at 3.4. How about now? Sean? Sean? Really? The dye just, where did the dye go at 5.1? Oh, that wasn't 5.1, that's why. I'm wondering. How high is the pain now, Sean? That's 5.1. 10? I heard a 10. All right, so we got a 10 at 5.1. Is that where you typically get your pain? Is that where you get your pain? Can you hear what her answer is? Is that where you get your pain? All right. So concordant on all three. Basically, folks, English is not her first language. I can't say where she's originally from, but it's not the United States. That said, we want to make sure we understand the answers and she understands what we're saying. And we just verified that. She's wide awake. We're going to put her to sleep before we get started. Her surgery will take about an hour from now, hour and a half. I have to fix 3 discs. I'm going to start with 4-5, I guess, on the right side. Shot? All right. While she's going back to sleep, I'm going to take the needle out over the guide wire. I'm going to place the dilator over the guide wire, and we're not damaging anything inside her body right now. We're just spreading the muscle fibers and fascia apart. So that's what makes this procedure so minimally invasive. It's not an open procedure like invasive spine surgery like discectomies and laminectomies and fusions. This is a minimally invasive procedure, a true minimally invasive, and it's all done through a tube about the size of a McDonald's milkshake straw. Now, to be able to do this surgery through a tube that's the size of a milkshake straw, you have to use what's called an endoscope, which is a series of lenses and illumination that allows the surgeon to see at the very bottom of that skinny little tube. Okay? Remember, that tube is going to allow me to get into the herniation and fix it. Yep. Now, once I'm inside this herniation, I'm actually in the herniation and the tear. We'll show you the video once again on the Duke laser disc repair so you understand what's happening. But now that we've placed the tube, I want you guys to watch the video again so you can really understand what it is we're doing inside this herniation. Henry, show the audience the Duke laser disc repair lumbar video again.
Of course.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Now we are inside the actual tear that you guys saw on the video in the back of the disc, and we're on the right side. We're at L4-5. So if you take the L4-5 disc and you were to look at the back of the disc where the tear is, where the herniation came out, that tear is in the wall called the annulus, and this is called an annular tear. Specifically, it's a posterior lateral annular tear because it's in the back of the disc, it's on the side of the back of the disc. So this posterolateral annular tear is where the herniation of the nuclear material, which is the material in the center of the disc, normally acts as a cushion to cushion all movements of your spine and your lower back when you're lifting and bending. So this cushiony gel, it's kind of like the jelly in the middle of a jelly donut, has squeezed out through that tear. Now, how did she get a tear in the wall? The same way every human being alive gets a herniated disc. Trauma. Some type of traumatic event occurred in her past. We don't know what that is. Car accident, slip and fall, sports injury. Somehow, could even happen when you're being born, you're coming out of the birth canal. Somehow she injured her spine at some point in her life, and that injury caused a tear and fragmentation of the nucleus, just like you saw in the video. If you're not sure about it, go back and watch it. And all of our videos are available on our Duke Spine Institute YouTube channel in playlists. Henry has organized them nicely over the years, so they're easy for you guys to find and watch. They're categorized by body part: knee, shoulder, hip, lumbar, which is lower back, which is what we're doing today here right now, cervical, thoracic, and you can watch not just the animations which explain how the surgery is done, but you can also watch surgeries being done by me over the last 10 years. Our surgery center is at its 10-year anniversary this year. We've been broadcasting surgeries since the first day we opened 10 years ago in 2015. And you can watch, if you want, you can find our very first surgery, which is where I took a tumor out of someone's lower back and their spine. And I did it, it was an intradural tumor, which is inside the dura. I had to sew the dura back together, I had to seal the dura, and I had to take this tumor out. So that was our first surgery we did in our surgery center. Of course, we've been doing mostly the laser surgeries over the last few years, but before that we did fusions of the neck, fusions of the back, thoracic fusions, lumbar fusions, cervical fusions, cervical laminectomy infusion, discectomy infusion, microdiscectomy, laminectomy, you name it, we did it. Spinal cord stimulator removal. We have lots of these surgeries on our YouTube channel, categorized. Also, some of them are on our website. If you go to our website, dukespine.com, you can probably find, under the different pages and sections, videos that correspond to that section. We have an entire section on our website dedicated to other treatments besides those done, besides the laser surgery and plasma surgeries that we do. We have an entire section on laminectomies, fusions, spinal cord stimulators, you name it, they're there. Remember, we believe there's an appropriate treatment for each patient. It just turns out that in most patients that appropriate treatment is less invasive than what your doctors are recommending. And that's because your doctors, number one, don't know how to do what we do here at Duke Spine. We're doing more advanced technology and techniques. And number two, the doctors where you are probably don't want to do these less invasive treatments. The more invasive the surgery, the more money they make as a surgeon. And they're basically rewarded for recommending fusions to you, financially rewarded. That's where the most money is. As a matter of fact, a lot of people don't even know this, but fusion surgery pays the surgeon the highest amount of money in all of medicine. There is nothing that pays as much as fusion surgery. Spinal fusion surgery is the highest paying of all surgeries. Okay? You should know that. And why is that important? Because surgeons will recommend what benefits them most and not necessarily what benefits you the most, the patient. So be aware of that when you're assessing and evaluating the treatments that are being recommended to you by your providers. Okay? You need to be aware of the truth. The truth is spinal fusion, spinal surgery is the highest paying of all surgeries to surgeons. This procedure pays the surgeon about 1/10, 10% of what I make during fusions. So if I was motivated by money, just making money, I wouldn't be recommending laser surgery. I'd be recommending fusions, which is what most doctors do. Now, a lot of surgeons know that patients won't do fusions right off the bat. So they've developed a strategy, if you will, to recommend laminectomy first and then to recommend fusion when the patients come back with severe pain from the laminectomy they did. It's quite interesting. But that's exactly what happens. You're going to get a recommendation for a less invasive treatment like a laminectomy or discectomy, but you will come back within a year or two and you'll be in severe pain and you'll be begging for a fusion, begging. So that's how these surgeons have developed a counter strategy for patients. How do I know this? Because I see it all the time in people that come to visit us. They all tell me the same story over and over again, how their surgeon recommended a laminectomy, and then they had to take them back within a few days, a few weeks, a few months, even a few years, and they had to do a more invasive procedure like a fusion. Okay, so it's obvious to me, we all know as surgeons that when you go in and start taking bones and ligaments out of people's spines, which is what laminectomy is, that they're going to end up with more instability, more pain, and they're going to end up coming back and begging for a fusion. So that's what's happening today, unfortunately, in the spine world and back pain world, and if you go see a surgeon. And the pain management doctors, they're not going to fix your back pain, because all they offer you are shots or treatments that basically spinal cord stimulators, MBB, RFA, radiofrequency ablation, those things never last. Patients come back every time, they get more procedures, and the pain management doctors love it. That's how they make their living, with you coming back over and over again and getting more and more treatments from them. They love that. Insurance will pay for it because insurance knows that at some point you're going to stop coming because it doesn't work. So they'll have to cover something. They might as well cover something you're not going to want after a short period of time. And the payments for those treatments are very cheap. So insurance companies don't have to pay much, but they end up being able to at least offer you something. Now, of course, they make you jump through hoops to get there, but eventually they authorize it. Now, this is all scar tissue in her disc at L4-5. This is what was crushing on her nerve. This comes from herniated disc. So it's scar tissue combined with disc herniation at L4-5. This is what's pushing on her nerves and going down her legs. This is causing horrific symptoms in her legs, like weakness, fatigue. We call it neurogenic claudication. She also has back pain from the same thing, the annular tear. But this scar tissue here is very dense, very hard. It's like a rubber ball, and it's pushing back on her nerves, going down her legs on both sides, and that's one of the things we're here to fix today, okay? All right, we must have some questions. Hold it. You got it?
Yes, we do. This first one is a comment and or seeking advice from Morgan on YouTube, saying, I was involved in an auto accident and have pain down both legs and lower back. MRI revealed severe spinal stenosis, arthritis, bone spurs, and degenerative disc disease.
Yeah. Well, my friend, come to Duke Spine and get fixed the right way with our technologies that actually cure pain. Unfortunately, most doctors can't cure the pain. They're just going to put you in treatments that prolong your suffering, and you'll just end up going from shot to shot or treatment to treatment. But if you want to get rid of your back pain permanently, do one of our free MRI reviews we offer at Duke Spine. We do them every week. You just have to fill out the form, submit your MRI for us to review, and then I'm going to do an examination of your back. I will diagnose the source of your pain, and then I'll recommend a treatment based on the diagnoses, okay? It's diagnosis-driven treatment. That's what we do. That's the right thing to do for patients, is to figure out where their symptoms come from and then treat that source. And we now have the ability to do that, but it's not everywhere. It's not where you live, for example, unless you live where we are. The problem is, out of every 100 doctors that treat back pain, only one of them can actually cure it. And that's being generous. So, what that means for you, Morgan, is you're going to have to travel, most likely, to somewhere where they can actually fix your back permanently so the pain goes away. That's what this lady did. She traveled from Nevada to Florida so we can do this surgery. Now, she's had surgery before. Remember I told you guys earlier, she had the discectomy surgery And that discectomy surgery has left her with all this scar tissue that is now bulging out, pinching her nerves. And unfortunately, a lot of people think, and they're told by their surgeon, that they have to do a fusion when they have a spondylolisthesis, but it's not true, okay? There's a huge disagreement out there in the spine world about spondylolisthesis. And I used to be of the opinion that you had to have a fusion. And that's true. You do if you're going to do a decompression. So if you come to me and, 10 years ago, 15 years ago, and you said, my leg symptoms are really bad, then I would say, all right, you need a decompression. And if we're going to do a decompression, open decompression called a laminectomy, foraminotomy, then guess what? We have to fuse you. Because that open decompression, that laminectomy that we would be doing to get rid of your leg symptoms, I would have to go really wide. I would have to take out your facet joints to make sure I get the nerves unpinched all the way. And when a surgeon takes your facet joints out, basically your spine will just wobble itself apart. So you have to do a fusion. So do you have to fuse when somebody has spondylolisthesis? Yes, if you're going to be doing an open surgery, invasive surgery called a laminectomy, then you really do need to do the fusion. This is all scar tissue from her prior surgery she had, okay, at Laser Spine Institute. And this is inside the disc, inside the tear, inside the herniation. We're just about done on this right side, okay? A little bit of fat right there, but that's the ligament. Any other questions?
Yes, got a few more questions coming from Lanu on YouTube. Asking, does your arms feel sore when holding the scope for a long time?
That's a great question, Lanu. No, they don't. To be honest, the scope is pretty light, and if I have to, I'll just rest my arms on the patient's back. But generally speaking, it's not too bad. All right, this is a really, really messed up disc. You can see scar tissue, you can see calcium. I'm trying to reach in and just see if there's any more pieces I can pull out of this herniation before I leave. There's a piece. It's not too big, but it's... remember, when you're doing surgery for these herniations, can we stay on top of the irrigation, please? No. That's a question to you, Sam. I have no irrigation. All right. Did you hear what I said to you? I said, can you stay on top of the irrigation? That's the right answer. By answering yes, you're acknowledging there's a problem, and you're acknowledging that you're going to fix it. All right? So that I don't have to get somebody else to come fix it. Thank you. All right, any other questions?
Yes, next question coming from Ping on Facebook.
Yes, Ping.
Saying, morning doc, if you were to herniate a disc yourself, is there anyone you would trust to do the DLDR on yourself?
So it's a great question. The answer is no, not today. I don't have anybody I would trust. So I just have to be careful. I will say that I work in my garden and I'm frequently lifting pots, with plants. And last year I lifted a pretty big pot, and sorry guys, this is just taking so long here. This scar tissue is amazing. And I had back pain for about a week, and I'm sure it was a disc herniation. That said, it went away, and but I'm sure it's going to come back again. All right. I think we're pretty much done here. I'm happy with what we've achieved. Remember, you're never going to get rid of 100% of the herniation. And this thing that people need to understand is, see all these little pieces coming out? Those are the herniation. but we don't get it out as one big piece most of the time. It comes out in small pieces. So that's pretty much it for this disc. You can see the back of the disc. I may just do one more zap there. I don't know, it looks like there's a bit pink tissue. Pink tissue tells me inflammation. That's where pain comes from. I just want to make sure we get all that. That's a lot of scar tissue from her prior surgery, and I just want to make sure I get any more pain fibers that are in there while we're here. I don't want to have to come back again. All right, any other questions?
No current questions, so we do have a comment coming from Morgan once more on YouTube.
Hi, Morgan.
Saying that I had also 2 laminectomies, 1 discectomy with a drop foot after.
Yeah, so Morgan, you had a complication. Your surgeon gave you a drop foot. That's exactly why we tell people to come to Duke Spine. You are living proof, and we see this all the time. Bad surgeons doing bad surgery. Very common all over the United States. There is no quality control for these surgeons, folks. When you go to a spine surgeon's office, you could be walking into the office of a spine surgeon who was a B student in class, goofed off during residency, or just never had the mental capacity or technical ability to learn surgery, how to do it properly. There is a tremendous discrepancy, disparity, difference in training for neurosurgery training programs. I was fortunate enough to go to the best in the world, which was the University of Florida in Gainesville at the time, back in the 90s, but it's no longer the best. But here's the thing. Each of these residencies for neurosurgery, which train spine surgeons, by the way, they take 1 doctor a year from the whole world. 1 a year. They train 1 a year. So if you want to get a top surgeon, you have to get a surgeon trained at a top neurosurgery program. And a lot of those neurosurgeons do brain surgery, aneurysm surgery, AVM. They don't do spine necessarily. So the deck is stacked against you. It really behooves you as a patient suffering to come to Duke Spine Institute, where you know you're going to get the very best care in the world, where we have very successful treatments that work and a very, 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 very low rate of complications like drop foot. Drop foot is a complication of surgery. Spinal fluid leak is a complication of surgery. Complications during spine surgery should be almost non-existent. I've never had a drop foot. Doesn't mean I won't get one, but I'm patient like this is very high risk for that because of all the past surgery, and the anatomy is very distorted. But for a patient who has an uncomplicated herniation, stenosis, annular tear, which is 95% of the people out there, this should be a pretty straightforward surgery without any problems. Sorry about that, but maybe we can still help you. I would still recommend you do the MRI review. All right, we're getting into the next disc, which is the right 3-4. And I'm going to do the Duke laser disc repair here, and then I'll do the right 5-1, and then I'll go to the left side. Any other questions?
At this moment, no current questions.
Why don't we show the audience the microdiscectomy procedure,
Of course.
which so many people have and so many people are recommended by their doctor, which we recommend against. Watch this animation and you can see several things. One, the skin incision is much larger, which means more bleeding and more scar tissue. Number 2, you have to peel the muscle off the spine, which then causes more bleeding and more scar tissue and more postoperative pain compared to the Duke laser disc repair. Number 3, you'll see that surgeon is removing bone out of the spine. That doesn't happen with our surgeries here. Okay, taking bone out of your spine is never a good thing. The reason they do that is to get down to the herniated disc. You see, they don't have a transforaminal approach. They don't have the ability to do what I do. Right now, we're not taking any bone out of the spine. We're going through a natural opening between the bones. And that was a technique developed by Parvis Cambin. Dr. Cambin is an orthopedic surgeon. He worked in Pittsburgh at the, I think it was at Allegheny or the University of Pittsburgh. He taught orthopedic surgery, spine surgery, and he developed this transforaminal endoscopic approach. The first transforaminal surgeon was Dr. Wiltsey. He was a neurosurgeon. He actually did the extreme lateral approach, where he approached the foramen from the back, from the side, in a muscle splitting incision. And then Dr. Camden figured out, well, if you can go from the back, you might as well go further to the side and just go through the foramen. And since Camden was an orthopedic surgeon, he learned how to do arthroscopic surgery. So he took that arthroscopic tube, the arthroscope, which very few neurosurgeons know how to do arthroscopic surgery because we're not trained to do it. I mean, that's changing now because some brain surgery is done arthroscopically, or endoscopically, I should say. So Camden was the first to bring the endoscope to the spine, from the knee to the spine, and start doing these procedures through the foramen. Ah, shit. I hit the needle. You guys see the needle from the other side?
Yes, we do.
I melted it, so hopefully we'll still be okay. It's very easy to do. It's not something I want to do, but it was hiding in the herniation right there. This blue stuff is all herniation. Nucleus pulposus. All right, so far good questions and comments. I hope Morgan does our MRI review to see what I can do to help him. It's free, Morgan. You do it from home. So there's no flying to Florida for just a consult. We can do it all from the comfort of your home. And I can tell you exactly what needs to be done to help you get the very best humanly possible results for your back. Robert, any other questions?
No current questions. So in the meantime, why don't we show the audience what is a microdiscectomy?
Thank you.
A large incision is made. Muscles are torn from the spine. Substantial bleeding occurs due to muscle trauma. Normal, healthy bone is removed to access the herniation. Stabilizing ligaments are removed in order to access the herniation. An incomplete portion of the herniation is removed. Dense scar tissue forms. Weakened bones can fracture, leading to instability and pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.dukespine.com.
Welcome back. We were just talking about our patient last week. If you were here, we did a patient who weighs 380 pounds, almost 400 pounds. So this guy had multiple disc herniations, and his whole life was destroyed by his back pain. He was obese. He was put on 200 pounds of weight because he couldn't do anything. His back hurt so bad every time he tried exercising. And he, immediately after surgery, his pain was gone, and he was very happy. Then 2 days later, he texted me over the weekend and said, "Thank you so much. You saved my life. I'm walking 5 miles a day right after surgery." And he said, "I have no pain. My life is just totally so much better." So Dr. Berndes was asking me about him, and I was just telling him. That was our patient last week.
We all enjoyed working with him. Very nice.
Yeah, he was tough. He was tough because he was so overweight that by the end of the surgery, he was having trouble just breathing properly. So we had to abort his SI joint, and we're going to have to do that in the future.
But he had a great attitude. He said he felt comfortable with us.
Yeah.
He watched so many videos.
Yeah, he watched a lot of videos. So, Well, there's the melted needle that I hit with the laser, and you can see the laser will melt it right away. Like literally one blast and it melts steel. That's how powerful the laser is. That needle is coming from the other side. Remember, this is a bilateral disc. We're doing both sides, left and right. Right now we're on the right side. We have to go do the left side later. Why are we doing both sides? Because the patient has leg symptoms on both sides. The side of the leg symptoms determines the side that I go to fix the disc. If it's right leg, then we go to the right side. If it's left leg, I go to the left side. If it's both legs, then I need to go on both sides. So, any other questions? So you saw the video on microdiscectomy. You see what a destructive procedure it is. It's an old surgery, over 100 years old, and it's very destructive. We don't recommend that procedure anymore. There's a lot of calcium right here. You guys see the orange color, the golden orange?
Yes, we do.
That means a lot of calcium in that disc, in that scar tissue. It's been there for a long time. It's all scar tissue here from inflammation happening in the disc. There's the pink tissue, the inflammation tissue I was talking about. Some people say, Dr. Duke, I thought discs don't have a blood supply. How do they get inflammation if there's no blood supply? Well, the truth is discs do have a blood supply. It's normally in the outer half of the annulus, where we are right now. But how does it get to the inside of the annulus? It grows there over years. That's how. It grows down into the disc. The more inflammation the herniation causes, the more it grows. These are fibers of the posterior ligament, and you can see herniation is stuck in them, and I have to remove that herniation to treat the patient's symptoms. Any questions?
No current questions, but we do have a comment, a blast from the past coming from Reiko Pilot on YouTube.
Oh, wow.
Yeah, saying, visiting to say hi to Dr. Duke, my superhero. I had myelopathy from years of, quote, repetitive trauma driving a school bus. Dr. Duke, you saved me from paralysis 3 years ago now. I wanted to pop in and reassure anyone watching that Dr. Duke is the best and will take wonderful care of you.
Oh, thank you. Dr. Berndes says he remembers you. He says remembers well and wishes all the best to you. Thank you so much, and so do I. I remember you very well, and thank you for popping in. And yeah, I mean, yeah. If I remember correctly, you went back to work the next day. So we're driving a bus, which is great, and it's perfectly fine to do that, by the way, folks, because our patients are not taking narcotic painkillers after the surgery. That's one of the advantages of this surgery, is no post-operative narcotics. You can't drive a school bus when you're taking opioids. That means those kids' lives would be in danger. So, yeah, the school district would frown upon that quite a bit. So I'm happy to hear from you. It's always wonderful as always, so thank you. Any other comments, questions?
At this moment, no comments or questions.
In that case, I do want to shout out to my alma mater, Florida Gators.
Yes, they just won last night, yeah, for
Who won the NCAA championship. Congratulations, Gators. We have a lot of Gator support in here, I'm sure, right, Jordan? Any Houston? No. Sam, really? You're a Houston fan? Are you serious? What? All right, so basically, you're happy the Gators. You would have been happy if Houston won. As long as somebody beat the Gators. You sound a lot like those liberals on TV that are just anti-Trump. They don't care. They just don't want Trump to be president. Am I right? Like, they can't be happy that he's president and doing good stuff. They just the fact that he's president will be bad. So if the Gators, as long as they lose, you're happy. Even though you're not a fan of Houston. All right, well, I watched the game. I think it was a nail biter. I'm sure anybody that watched it would think that. It was a nail biter. It was a nail biter.
It's nice that a Florida team won. How about that? I'm happy
Yeah,
that a Florida team won.
good. I am too.
I might have lost last year at nail biter.
Yeah.
One shot.
I'm just
Yeah.
happy that a Florida team won. So we had FAU playing 3 years ago in the Final Four. Oh, and they're in Boca. I was raised in Boca, so.
Yeah.
But then Florida, given that, I'll take UF for sure.
Yeah. Dr. Berndes says he was raised in Boca too.
Oh yeah, we talked about that and everything, and so yeah, they were against San Diego State in the Final Four. It was like first time ever for them, and then they lost by 1 point, unfortunately. But last night it was much needed for a Florida team to win. That's
Well,
for sure.
listen, San Diego State, I went to UC San Diego for undergrad. That's my alma mater as well. San Diego State is a massive school. It is literally one of the biggest universities in California. It's humongous. It's a powerhouse in sports. So the fact that they were playing San Diego State and did so well, that's pretty amazing.
It is. It's a huge feat. Still talked about when I go down there, and so we take pride in that, and I'm very fortunate with that. But at the same time, I take pride with any Florida team just going anywhere and then winning, and so I give props to the Gators hugely.
Yep. All right. Any other comments or questions?
No current questions, so we do have a comment coming from Morgan once more on YouTube, just commenting on the Gators and everything, just saying very right.
Yeah, thank you. Yeah, I honestly, if the whole game, I was thinking Houston's going to win this game. They're just playing better than the Gators. And then the Gators had some miracle or something, a few miracle shots. And, Clayton, their MVP, he was a bit surprising. He just was a dud the first half. He scored 1 point. That's it. I mean, this guy is like the MVP of the league.
I know. He's a contender for the draft next year.
Yeah, they just shut him down on D. He couldn't do anything. And so I really thought Houston was going to walk away with the victory. Of course, I wanted Gators to win because they're my school. As a matter of fact, when I was there doing my neurosurgery training, they were the national champions in basketball, men's basketball, and a few other sports. I want to say water polo or some other things. But yeah, we were enjoying their wins while I was there. And football. They were a national champion in football as well. So, all right, we are done here. You can see the fat. I want to point out that this disc did not get operated on before. You can tell what a difference it is. It doesn't have as much scar tissue as the last disc. If you go back and watch these two discs side by side, you'll see just how much more scar tissue the first disc at L4-5 had. This is the L3-4. It was bad, but it wasn't as bad as the L4-5, that's for sure. All right. So far, everything is going well. My anesthesiologist says she's sleeping comfortably, resting, very, very happy, not moving, not in pain. She's comfortably sleeping through the surgery. Her vitals are stable. She's not having any issues. And we're going to keep going and get these other 3 discs fixed. All right, so if you have questions, feel free to ask me. You can see the laser. By the way, every one of those little blasts you're seeing with the laser touching and the tissue is melting, each one of those is about 0.1 or 0.05 millimeters. 0.05 millimeters. Now think about that. That glass fiber you're looking at right now, that's 1 millimeter, 1 mm across, okay? So when I use the laser and turn it on and I direct energy through the tip, it's literally melting about 1/10 to 1/20th of a millimeter of tissue. So it's very, 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 very precise. Far more precise than any other surgical tool in the world. All right, very good. I'm happy with that. I think we're done here. And we're going to move on to the last disc on the right side, which is L3-S1. And then we'll go on the left side and do those two as well. All right, looks good, looks good. Let's see if we can see the nerve root. It's up there in the fat. But otherwise, we debulk the herniation. It's called a debulking. Debulking, it means you get the bulk out, okay? Herniation is a tumor, T-U-M-O-R. Yes, you heard me right, it's a tumor. Tumors aren't cancer. Tumor is just a mass or swelling. That's the definition, mass or swelling. And a herniation is a mass or swelling of the disc that's swelling or massing backwards, pushing on the nerves, okay? So that's what we just removed, part of that. And by the way, every disc surgery in the world that's operation on the disc, herniation, its goal is to debulk the herniation, to get rid of as much of it as they can. I say this many, many times. We as surgeons cannot remove 100% of any herniation. It's impossible. No surgeon can do that. And the best chance you have of removing the herniation is doing what I just did, which is basically looking with the scope, right? Seeing the herniation and then removing the herniation, which is what I did, okay? But everybody else that does a microdiscectomy, they can't see the herniation. It's very, very hard to see. They use a microscope sometimes or loupes, but you cannot see the herniation. So the surgery that offers the surgeon the very best view of the herniation is the one I just did. Okay, and the problem is I'm the only one in the United States that I know of that is doing transforaminal endoscopic surgery, which means everybody else is doing the old-fashioned surgery, which is the microdiscectomy, where they're cutting a big incision. They can't see the herniation, but they're sticking tools down there with the use of their eyes and loupes or a microscope at best. But here the endoscope gives us the greatest view of the herniation, the greatest accuracy and precision of everything. So it is the very best surgery. It's also the least invasive, the fastest recovery, the safest, and the most effective. We're working towards 5-1 on the right side. I was very, very concerned about getting to this disc because of her abnormal bones in the back here from her prior surgery, her sclerosis and hypertrophy of the facets, her curvature of the spine, all very abnormal, all impeding my ability to get in and fix her disc. Impeding means blocking, basically obstructing, working against me. All right, as we advance the dilator down to 5-1, I'm watching it advance on the X-ray. I'm going slowly, 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 and cautiously. I'm not really happy because what we've got here, folks, is, look at that, a situation where, hold on, not all the way, but just pull back some. Yeah, it's too tight. Did you get it? Oh, nice, Luis. All right, let me just see what we got here. Yeah, go ahead and take it out. We're going to take the guide wire out. All right, well, this has been really challenging. 5-1. Let's hope this works. I'm not happy. So the space I have to get in, I could barely get the needle in, and now the dilator is spreading apart the bones, creating space. Now she's going to be sore from this for sure, but hopefully this will work and help her symptoms. Normally there's a 5 millimeter space to get down to 5'1" on the right or left, but because of her curvature, because of the enlarged bones, the collapsed disc, the spondylolisthesis, the prior surgery, scar tissue, all of that has made that 1 millimeter hole a 0.5 millimeter. So we went in, and hopefully we're in where we need to be. Yep, it looks like we are. There's the disc herniation right there. So thank God that we're in where we need to be, and we can help this lady. Even if we just did the 2 other discs, we'd get a great result. But look at that herniation. That blue thing is the herniation, folks. This is great. I'm so happy we're able to do this. Getting it out. Any questions?
At this moment, no current questions.
Yeah, so what I can tell you is she tricked me. She's a very nice lady, but she tricked me. She is skinny, and her spine is posterior, which I like, but she's a level 10, maybe even higher if there's such a thing. And it's not because she's overweight. She's super skinny. And by the way, how much does she weigh?
109.
She weighs 100 pounds, folks, 100 pounds. Okay? So if you're out there and you believe that fat people get back pain because they're fat, forget about it. This woman is skin and bones. She's 100 pounds, 109 exactly. She's not fat. There's no fat on her, but she has horrible pain. Okay? People have back pain not because they're fat. They get fat because they have back pain. So let's stop blaming fat for back pain. Fat is not the cause of back pain. Okay, I know what's the cause of back pain. And you saw that video earlier today, and we're going to show it to you again to remind you. For those people who came in late, Henry, let's share with our audience the 30 different causes of chronic back pain. And by the way, pay attention, because none of those causes equals fat. None of them are fat. Okay, being overweight, obese, morbidly obese, whatever you want to call it, they do not cause back pain. They're the sequela of back pain because you can't do anything. Your back hurts all the time, so you just kind of lay around and get inactive. This surgery that we're doing is to increase people's activity and quality of life. This is not a cancer surgery. This is surgery to basically give people back their life. There's millions upon millions of people not living life to the fullest because of their back pain. And we're here to fix that. Okay? It's still elective because you, the patient, have to elect to get the surgery done. You don't have to do the surgery. It's your choice. But my advice, get your back fixed. Don't put it off. You now have the ability to cure back pain at Duke Spine Institute. It's not available anywhere else. It's available here. So make the trip, get on an airplane, get in a car, fly, drive, do what you got to do. We can fix your back and neck pain right here at Duke Spine. If there's no questions,
No current questions?
the audience of 30 causes.
Of course.
I'm Dr. R. Dugmajian with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Majan. Thanks for joining us. All right, welcome back. Thanks for watching our video. You can see, once again, I'll talk just briefly about the video you just watched. By the way, right here, we're at 5-1 on the right. This is the herniation. I'm lasering it away. It's painstakingly slow because it is so dense with so much scar tissue from chronic inflammation. We were just talking about a friend of mine. He's a plastic surgeon over in Fort Myers area. He's probably going to close his business down. They're just not busy these days. I got to tell you, I think it's funny because I remember, oh wow, I almost cracked the laser fiber. I remember because Warren Buffett owned some type of hair extension company, you know, where they do hair extensions. You know what I'm talking about? Like a national hair extension company. And I thought to myself, why would anybody like Warren Buffett buy into a hair extension company? And I realized a lot of those people are doing hair extensions for their TikTok videos and their OnlyFans sites, right? So then it kind of opened my eyes up to all these people making money by, you know, whatever you call it, these digital services. And I thought to myself, with AI, they're all going to be out of business soon. Because if you see the AI models that are being created, they literally look like real people.
It's getting worse, much worse.
And they're perfect.
Yeah.
I mean, literally perfect.
It's getting really, really scary on that. And like, I was watching this video the other day of just like an AI person talking into a mic, like it's a podcast and everything, but like it's not real at all. I'm like, it's just getting very, very, very realistic.
I know.
At a rapid pace.
Can you imagine if humans are taken over by machines, just like that Terminator movie?
I was just watching Judgment Day the other day, the Terminator 2.
Honestly, we watched that back in the 80s and we laughed at it like, this is crazy, right?
Yeah.
Matrix, Terminator.
Yeah, exactly.
But my God, these directors and screenwriters, they were
ahead of their
visionaries.
time.
They were ahead of their time. Because humans may actually go extinct.
Ugh, let's not get
I
to
mean,
that
think
point,
about
but
it.
Yeah.
Who's a more efficient life form? A human or a robot? I mean, the Earth cannot possibly handle all the growth of human life and the pollution and toxicity of the environment. The Earth is going to just crap out. But in all seriousness, what's going to happen is we're going to get another ice age eventually, and it will be a near extinction, mass extinction event. So that's inevitable. Ice ages, they happen I think it's 500,000 years. I was talking to my mom about it. I said, have you heard of the Ice Age? She said, the movie? And I said, no, the movie is about a real event that really happened in history. A lot of people don't realize the movie is actually on a very serious topic.
Yeah.
Right?
Yeah.
So what happens is our carbon emissions will increase so much that the greenhouse gases will get trapped, and they'll raise the global temperature so high that it will be incompatible with life, organic life, like humans. I mean, of course, there'll be those that survive, the, you know, survival of the fittest sort of thing, Darwinian, evolutionarily. But what's going to happen is those greenhouse gases will get trapped, the Earth's temperature will rise massively, it'll be incompatible for 99% of organic life, and there'll be a mass extinction event. All right? And then, when that happens, guess what happens? All the greenhouse gases go away over the next 100,000 years because we're not producing them anymore. So then you get an ice age where there's no CO2, carbon dioxide in the atmosphere because humans aren't producing it anymore because we're extinct. And then you're going to get another ice age because Earth will chill. Right? That's exactly what happened 500,000 years ago. It's going to happen again. You can learn a lot from studying history. I'm not trying to be political by any means. I'm not.
No, it's scientific.
I'm just being scientific.
Yeah.
All right, so we just showed you guys 30 causes of back pain for humans. Now, if you ask me what are the 30 causes of back pain for a robot, ask me that in another 15 years. But for humans, the number one cause of back pain, chronic back pain, is this right here, a disc tear. A tear with a herniation, an annular tear with a herniation in the back of the disc. And that's exactly what we're fixing right now with the Duke laser disc repair, okay? So that is 85% of people with chronic back pain. That's back pain lasting longer than, say, 6 weeks. 85% of those people, their back pain comes from this right here, this disc problem, okay? And of those 85% with disc pain, the average number of discs that are causing pain is 2.4. For your sake, I'll just make it easy. I'll make it 2.5, right? 2.5. So what that means is, if you think about it, the most common cause of back pain, chronic back pain, is a disc injury, and it's not one disc, it's 2.5. All right, so if your doctor is recommending fix one disc, there's a problem. That means you're still going to have back pain afterwards. Okay? The only way to actually get rid of the back pain completely is to fix, on an average, 2.5 discs. So that's what that means. That's why numbers are so important. We looked at 5,000 patients with chronic back pain. This was last year. Arias Dukmajan did the analysis, spent his summer going over all of the records, and he determined, and by the way, I did a confirmatory sampling of 500 patients and found exactly the same result, that 85% of patients with debilitating back pain, it comes from a disc tear. So disc is number one. Number two is facet, F-A-C-E-T joint. Number three is the SI joint and the piriformis muscle. That's 3 and 4, and they're basically tied, and they comprise about 5%, technically 6% of back pain comes from the SI and the piriformis. That's 3 and 3. So 85% disc, 10% facet, and 5% split evenly between SI and piriformis. Duke Spine Institute now holds the patents on curing all these conditions, 99% of back pain with a 99% cure rate. So why would you go anywhere else if you have back pain? You shouldn't. Not in 2025, maybe in 2050, maybe in 25 years from now, other doctors will be doing what we're doing, shot. But for now, it's just us. All right, we're going to do left L4-5. Remember, this is the level with spondylolisthesis. Can you guys see the spondylolisthesis, the slippage of one bone on the other?
Yes, we can.
Jordan will show you. There's the front of L5 right there, and show the front of L4 way over there. They're supposed to line up together, but they're not. And the reason, this patient has a slippage. Now, for the next 20 years, doctors will be telling patients, the slippage is the problem. It's causing your pain, but it's not true. It's not true at all. And they're telling you that out of ignorance, probably, some out of malicious intent. But the truth is, the slippage does not cause back pain. Now, can it pinch a nerve? No. What's pinching the nerve is the herniation that happens with the slippage. Hold on. Let me just pull this back. Shot. Okay. Any questions from the audience?
Yes, we have a question coming from Morgan once more on YouTube.
Take.
Asking, what are the chances of regaining use of a drop foot with your procedures?
Morgan, great question. So I love the question. What's the chance of getting back my drop foot to a normal foot with my procedure? The answer, 100% depends on what's the cause of your drop foot. Now, if the cause of your drop foot from your prior surgery is that the surgeon did not take the pressure off the nerve, which is what I think it is, then I can fix it. And I would give your chances at 80% restoration of normal function. On the other hand, if I look at your MRI and you have nothing pinching that nerve, nothing at all, then that means the surgeon cut the nerve during surgery and the chance of me fixing it is 0. But I will be able to tell you that by the end of our meeting. Is that worth it to you? I would hope so. I know I would do it. If there was a chance I can get my function back in my leg, I would 100% do it. I would do the MRI review, and if there was a great surgeon who could do it, the surgery, and felt 80% success rate, I would 100% do it, without a doubt. I personally don't like living life with deficits. And I don't think any human being should. It's very sad. The surgeon never should have given you that deficit. And there's just a lot of bad surgeons out there. I don't know what to tell you guys. Stay away from them. That's why it's important to go somewhere you trust. Okay? I'll give you an example about trust. A fun little story. I went to Washington, D.C. last weekend with my wife. And we went for the purpose of, number one, visiting and seeing the cherry blossoms. That's these trees along the basin and throughout D.C. where they bloom once a year for about 2 weeks. And by the way, if you're wondering where is the best place to see the cherry blossoms in DC, there is one place that is the best. It is the Martin Luther King Memorial, the MLK Memorial. We went there, and holy God, if you go there on the peak day, you have to look at the internet. There's a science to this. It's kind of like watching a solar eclipse. You can't do it the next day or the day before. You got to know exactly when the solar eclipse is happening, and you got to look at it from the right place. Okay? So if you want to watch the cherry blossoms in DC, the best place to watch them is in Martin Luther King Memorial, and the best thing to do is to look at the peak. It's only about 1 day is the peak, and you must be there on that day. Because if you go the day later or 2 days later and there's wind or rain, it will definitely affect the blossoms. They will close down and you won't see them. It's worth seeing. All right, so we remember this was a conversation about trust, right? You need to find a spine surgeon you can trust. And there's a lot of bad ones out there. A lot. So don't just trust them because they work at Johns Hopkins or University of California, San Francisco, or Harvard. They are not the best spine surgeons in the world. Okay? They are not. So I'm going to DC. We're at the airport. I'm hungry. And we have 2 hours before the flight. And there's a Mexican restaurant, okay, called Qdoba in Orlando. Now, Qdoba is one of those Mexican restaurants where sometimes the food is good, sometimes it's not so good. Okay? It's not like Chipotle, where you can be sure that when you go to Chipotle, you're going to get consistently safe to eat food. So I went to Qdoba and I had this burrito bowl, and the woman behind the counter, I don't know, she just struck me as odd. She was making my food. Don't ask me what was odd about her. I couldn't tell you. All I can tell you is that I took a chance. I went to Qdoba. My wife played it safe and went to Wendy's. And let's just say there was this guy in Mexico. His name was Montezuma. Montezuma, all right? He was the leader of the Aztec people. And when the Spaniards came over and killed all the Aztecs and took over Mexico, all right, Montezuma died in the fighting along with hundreds of thousands of his best soldiers, all for the Spaniards to get their gold and other things. Well, Montezuma is attributed to a medical condition called Montezuma's Revenge. Montezuma's Revenge refers to a severe gastrointestinal ailment caused by E. coli bacteria found in food, usually Mexican food, and that bacteria is called enterotoxigenic E. coli, ETEC. And it has a heat stable protein that the bacteria produces in the food, or actually, it produces in your gut, and then it makes its way into food. And you can imagine how it goes from one person's gut to your food. Okay? It's called fecal-oral transmission, from one person's feces to your mouth. It typically by vegetables that are not cooked, like lettuce. Anyway, I spent 2 days in the hotel room praying to God and wishing the Spaniards never invaded Mexico. Okay? So why is that important? It ruined my damn trip. Okay? Quality, quality, quality. Quality, quality, quality. Take a look at this, folks. This is the cheddar right here, the big cheddar, the big C. That is inflammation right there. That's where her back pain is coming from. It's pink. If I look really close and I had a microscope, you would look inside and you would see dilated blood vessels, little pain fibers of nerves called type C fibers or type 4 fibers, unmyelinated pain fibers. And that is where all of the pain is coming from. Okay, and I just zapped it away with a laser. Getting back to the quality issue. Stop trusting surgeons and hospitals and companies that sell metal implants to do what's best for you, because they're not going to. They're going to do what's best for them. So go somewhere where you know the results are consistent and they are trustworthy and they aren't going to make you sick. All right? That's the message. For 10 years I've been broadcasting. We are literally on the doorstep of our 10-year anniversary in June of this year. What is that, 2 months? In 2 months we will reach the 10-year anniversary for Duke Spine operating room and broadcasting live spine surgery here. Duke Spine's been in business now for 20 years, but our surgery center opened 10 years ago. And I'm going to tell you something. Quality is so important. You don't think about it. You all think that we're all the same as spine surgeons. We're not. There's a huge difference in quality. The thing about Montezuma's Revenge, it lasts for 2 days. A complication from spine surgery lasts a lifetime. Don't let it happen to you. Do the right thing. Travel to Duke Spine. Let us fix you the right way, safely, without complications. All right. Questions? Comments?
Questions and comments. We have 2 questions, but before we just say anything, I want to say, as a person who went to Qdoba pretty often, I can agree with all of that. It's a hit or miss. Next question is coming from Pavel on YouTube.
Hello, Pavel. Welcome.
Asking, can a fusion procedure be reversed and DLDR be used to correct those symptoms?
Yeah, that's a great question, Pavel. So it's a very tricky question for me to answer, okay? And I'm going to tell you why. First of all, let's say, number one, let's say the fusion was done perfectly and there's nothing wrong with the fusion. Then you don't need the DLDR where the fusion is, because it won't do anything. The fusion itself is not causing the problem. It may be next to the fusion, the next disc or the next facet, but the fusion is not the problem. So you don't need a fix when you have a fusion if it's done properly. The question is, was it done properly? And only I can answer that by looking at your fusion using an MRI and maybe a CAT scan, if you're following me. Okay? So, if the fusion was done perfect, then that's not the cause of symptoms and it does not need treatment. It would be the adjacent areas next to the fusion that need treatment. And the only way to know that is to do our MRI review. That said, 90% of the fusions I see out there are not done perfectly, and there is a problem where the fusion is. Now, can the DLDR be used to undo the fusion? No. There's no way to undo a fusion, but the DLDR can definitely be used to go in and fix what the fusion did not fix. So yes, it's still worth doing under certain circumstances. And I've seen a lot of patients that had spinal fusion in their back where the herniation is still there. The surgeon never took it out, and I can go in and treat it with a laser, and that fixes the patient's problem. Okay? So great question. Not an easy answer because it really just depends on the circumstances, and everybody's a little bit different.
Next question is coming from Andy on YouTube,
Hi, Andy.
asking, is it possible to reverse failed fusion surgeries? I have loose pedicle screws at L3, and my physician has confirmed it's not impinging on any nerves.
Yeah, my advice to you is do our free MRI review, find out the real cause of your symptoms. There's too many possibilities of what could be, and I can figure it out if you give me 10 minutes of your time and your MRI. I cannot figure it out by just having a conversation like this without seeing your MRI after your surgery, a CAT scan, and doing an examination. I need to see you on Zoom. I need to examine your back on Zoom. I will be sitting at my desk on my computer, and you will be home in your room, and I'll have you take off your shirt, and I'll have you show me your lower back, and you're going to show me where your symptoms are coming from. I'm going to have you press on some areas to see if there's any tenderness or pain. I'll want to do an examination of the skin, an area where the surgery was done, and then I can tell you what's wrong and how to fix it. That's the best advice I can give you. All right, we have about 2 minutes on this disc, and then we got one more, we're done.
And at this moment, no current questions.
Thank you. We're a little bit overexposed. We could take it down a notch. Yeah, thank you. You can see some more inflammatory tissue there. There's fibers of the posterior ligament. You guys see the white fibers there?
Yes, we do.
This is all scar tissue from chronic inflammation. But we're right at the end of the disc here. This is the last of it. And I just got to remove this, and we should be good to go. I need a... Any other questions?
At this moment, no current questions.
All right. Well, Henry, I think it might be worthwhile showing the audience the second most common cause of back pain, which is the facets. Why don't we show them a video on how we fix facet joint pain?
Of course.
For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-BACK, 349-6922. Facet joint injury is a common cause of chronic back pain. The inflamed facet tear generates pain signals. The best treatment for facet joint pain is the Duke plasma rhizotomy. Inflamed facet joint pain nerves are destroyed. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. Welcome back. I'm just being educated by my staff on how a program dedicated to the manufacture and distribution of drugs could be so popular in America today. All right, so they're teaching me about Breaking Bad, which I've never seen. So I was coming to work today and there was a truck burning on the side of the highway that caused a massive delay, literally 45 minutes just sitting there in a parking lot. And as I drove by this truck that was half burned, I thought maybe it's a mobile meth lab, but I'd never seen Breaking Bad. I had no idea that's the centerpiece of that TV show, right?
It's a very huge piece in the show.
Yeah. So I was just joking. Good. And now I know that it's a real thing. Shot? All right. That said, so you guys were telling me the main character is a chemistry professor, teacher, who...
That's your homework assignment. You gotta watch that.
I don't watch... All right, maybe I'll watch one episode.
It's
What is it, on Netflix?
Yeah, it's on Netflix.
Shot?
It's beautiful. It's.
Acting is the best acting you've ever seen.
I agree. It's some of the best.
Jesse is unbelievable.
Yeah.
Shot? All right.
Like everything makes sense. Like everything has a reason to be on the screen, and that's what's really unique about it and everything. I could go on forever about it.
Shot?
Given that, we do have two questions.
Wait. Yes, shot?
First question coming from Reiko Pilot on YouTube. Asking, do you have anything special planned for the 10th anniversary soon?
What?
Reiko Pilot.
I heard it.
Okay.
What did you say? A party? I guess we should. We'll probably do a little celebration. But I think we'll do a little party. That's what I'm being told by my staff. So I think that's a great, very reasonable thing to do. Will we have it open to the public? I don't know. I doubt it. Only because, Open house? I don't know. These days have not been great days for our company financially. So we'll see. We'll see what we can do. I'll talk to the other boss, find out. But you're right, I think we should celebrate. But let's see. Maybe it'll coincide with a victory against Blue Cross Blue Shield. And getting... Yeah, could be. All right. Well, last one. This is this lady's final disc that we're fixing. This is the left 3-4, Luis? Yes. 3-4. And you can see there's a little bit of blood in here. That's blood clot. Why is there? Because remember, we were on the other side. So we already did the right side at 3-4, and there's a little bit of blood that went from the right side over to the left side through the disc. So that explains that.
We have a couple more questions.
Yes.
Next, coming from Andy, once more on YouTube, asking,
Andy.
what are the costs of Duke spine surgeries?
Yeah, good question, Andy. What are the costs of our surgeries? Well, first of all, as you know, spine surgery is not cheap, and the costs can be high. Now, the costs depend on what you're having done. So we offer about 200 different procedures, and each one has its own price. Plus, if you're having one disc fixed, it's one price, and if you have two, well, then you're going to have to pay for the second one. So the costs just depend on the procedure, and they depend on how many procedures we're doing, like at the same time. It depends on if you have anesthesia or not. So anesthesia costs more, obviously, but if you don't want to pay for anesthesia, we can just hit you over the head with a hammer. I'm just kidding. I hope you guys know I'm joking. But seriously, most of our procedures require anesthesia to go to sleep. You don't want to be awake. They can be painful. So I'd recommend it. We did have one patient who opted for no anesthesia, not because of money, but because he just felt that anesthesia was toxic and didn't want to put any toxins in his body, and I respect that. So we did the DPR cervical. This was a couple of years ago. I'll never forget. Remember him? He was hooting and hollering the whole time. And I said to him once we got started and he was hollering, I said, "You sure you don't want us to do anesthesia? We can do it. Right now we can do it." And we were ready to do it. And he said, no, don't do it, don't do it. I said, "Are you sure? You seem to be in a lot of pain." He said, no, I'm okay. Just keep going. So anyway, we got it done. Yeah, you were there. You were the anesthesiologist. I had Dr. Berndes there at the head of the bed. Yeah, you had the propofol syringe ready to go. You're like, "I can inject him, just give me the word." But he said no, and we respect patients' rights. And he was young and healthy, so it's not like he was going to go into AFib or anything. His heart was good, and he just was not wanting any anesthesia. So, all right, so anesthesia. Oh, no, we didn't do one level. We did like three or four. I think we did like one side, like left side, like 4 levels, DPR. Yeah. But to fully answer your question, our charges we have what's called a charge master. It's the same for every human being alive, but what we change is the amount of money we discount for the procedure. And, some people have the insurance guarantees they're going to pay, in which case we don't have to take money from the patient. And other people have insurance that doesn't guarantee they're going to pay, so in which case we have to take some money from the patient up front. And then we have some insurances, we have some without insurance, and we have some insurances we know for sure will not pay based on prior experience. So the amount of out-of-pocket for each patient just differs, even though the price of the surgery is the same. And it differs because of whether their insurance is going to cover 100%, whether their insurance is iffy, whether their insurance won't cover at all, or whether they don't even have insurance. A lot of people travel internationally. 5 minutes. And if you travel internationally, we can't count on your insurance paying us unless they prepay, which means they pay before your surgery, in which case it's better for us, better for you, because then we don't have to ask any money of you as long as your insurance prepays. So how much the surgery actually costs the patient just depends on a variety of factors.
We have another question.
Yep.
Coming from Andy once more on YouTube, asking, have you viewed the television program Dr. Death?
I have not watched Dr. Death. I haven't watched a lot of TV programs.
But you are watching Breaking Bad.
Yeah, I'm being told I have to watch Breaking Bad. And the program I like the most is Witcher. I've watched that a few times. I love The Witcher.
Great show.
Yeah, my favorite on TV. I watch a lot of news, Fox News. If you want to know the truth, you watch Fox. And even Fox isn't great, but it's, in my opinion, the best out there that I can find. Unfortunately, news these days, rather than giving us the truth and facts, a lot of these news channels give you their opinion, which I'm not crazy about opinion. I'd rather have facts. The old days, news channels gave you facts, and then you make up your own mind about the facts. But the truth is, most people would feel the same way about the facts. Like, for example, if a little girl gets murdered by a gang member, I think 99% of people would be sad for the girl. But nowadays, I guess there are people who think the gang member that murdered the girl who was there illegally, should not be deported. They should stay in America and not even serve a sentence. They should be let out of jail. Because, they can be rehabilitated. I think there's a lot of people out there with some very strange opinions. Point is, news should provide facts. Let us make up our own minds. People are usually smart enough to do that. We don't need the news station telling us what we should opine. But I watch news, and I do watch movies. I tend to watch older movies that I watch over and over again every couple of years, hoping that I forget the storyline so I can watch it and enjoy it and be surprised, right? But I don't watch a lot of TV. I watch a lot of TV shows. I did watch I think you recommended Damsel.
I thought it was great.
It's a great movie. I've already watched it 3 times.
Really?
Yeah. It's with that Millie Bobby Brown girl.
Yeah, great.
Oh yeah, great movie. Yeah, it's great. I think it's great.
Graphics were good, right?
Yeah. I tend to like to read more.
Watch Damsel? Just curious.
Henry, you ever watch Damsel?
I've heard of it.
I think it's a Netflix.
Yeah, it's on Netflix. I've seen the trailers of it and everything, but no, I don't think I would get around to it. I thought it was a movie, wasn't it? Yeah, it's a movie.
Movie. I think it's a really cool movie. Yeah, I took Dr. Berndes' advice and watched it. All right,
Yes.
What, you haven't watched The Witcher? What's wrong with you?
Yeah, you got to watch that.
You sick
Dr.
in the
Berndes.
head? Huh?
But yes, we do have a question coming from Frank on YouTube,
Which is the best? Go ahead.
asking, are you giving cash discounts? And if so, are you giving discounts if you're having more than one disc repair? Like if you're getting 4 disc repair, are you giving a little bit off on each disc?
Yes, we are. As a matter of fact, we have cash discounts. We do give off money. As a matter of fact, I think there's a special this month for surgery. You have to talk to the schedulers and find out what exactly it is, but we don't just talk about pricing. The way it works is you get a diagnosis, you get a recommended treatment, and then you get your pricing. So that's how it works. So you need to know what procedure you're having. All right, we're just about done. So we need a diagnosis first before we talk about procedures. We're not like a restaurant where we just have a menu and prices. We have, I'm like hitting something. Push this down. We have to first give you a diagnosis so we know what procedures you need.
No current question. Oh,
I do want to say one thing, since you guys are asking about pricing. Our prices are bundled prices. What that means is it's more of an advanced way of handling pricing and surgery, because when you go to the doctor's office, you just pay the doctor his professional fee or her professional fee. But when it comes to surgeries, there's actually three providers, three doctors, if you will, or three providers that are helping you. One, the surgeon. Two, the anesthesiologist. And three, the hospital, where the operating rooms are. So at Duke Spine, we have all three right here. And we bill for all three in what's called a bundled price, where we bundle everything together as one price for everything. The surgeon, the anesthesiologist, the facility, which includes all the staff that work on, and the medications and all the supplies, and the operating room and recovery. The biggest cost is by far the facility. That's about 90% of our charges. 5% is the anesthesia and 5% is the surgeon. So our costs are fairly low. My payment is extremely low. It's 5% of the cost. So is the anesthesiologist. And we don't get that money, by the way. It goes to pay our overhead. Rent, electric, staff, benefits. Unfortunately, running a medical practice company is very expensive. And that's due to all kinds of regulations and things that we have to comply with that costs us millions and millions of dollars a year, which is why surgeries are expensive, because you got to pay all those bills. We don't get any government funding. We don't get any charities. We would love to, but we don't. Hospitals get government funding. Hospitals get charity payments. Duke Spine gets none of it. So everything we live off here and pay all of our bills comes from our patients and the insurance companies that pay their bills when they do. So that's it. Any other questions?
No current questions, so we just have a comment coming from Andy once more on YouTube saying, my Medtronic spinal cord stimulator, despite undergoing multiple programming adjustments, has not yielded any therapeutic benefit.
Yeah, you're bringing up a great thing. Let me come over there and talk to you guys about that. So why don't we show them a video? You choose, Henry. If you want to show them the new knee DPR for arthritis of the knee, I think that would be a good one. We don't have the Duke Joint Institute website up, so don't try to go to the Duke Joint Institute website. But Henry, do you have that knee or not yet?
I do not have the knee just yet. It's still in the editing process, but I can pull up a testimonial, not a problem.
Let's do that, and I'll come answer the question.
Copy that.
And good morning, I'm Dr. Duke Majan. 30 years of back pain.
Yes,
gone overnight.
Yeah, overnight gone. It was amazing. I've been dealing with it, suffering. If it wasn't for my faith and belief and my friends back home that supported me, my wife, I finally got here to the Duke Spine Institute, and what an amazing experience it's been. Had surgery yesterday. I'm up walking around. I feel great. My pain was usually from a 6 to a 10 out of 1, if that. And I'm just so grateful that there are gentlemen in this world that really care about people like Dr. Duke, and I can't thank him enough. I recommend this gentleman to anyone who's been suffering and doesn't know where to go for help. I live in the state of Idaho. It's a great place to live, but probably one of the worst states to get hurt in.
Well, we are happy you're here in Florida to get your back fixed. And we did the Duke laser disc repair on your back and the Duke plasma rhizotomy on your facet joints. And you had a fusion done before, is that correct?
That is correct.
And we saw in your video when we were doing your laser surgery, you could see all the screws and rods, and you even have a broken screw at L5 on the left side, I believe. How do you feel comparing your fusion surgery with the Duke laser disc repair?
There is no comparison. 100% different. The fusion medicine didn't help me, made me worse. It gave me a heart complication that I still deal with. But since I've been here, the people are outstanding in this facility, and I can't praise them enough. And Dr. Duke is truly a godsend for people that are suffering. I can say 100% honesty that I feel totally different person. I'm just so glad that I came here.
How does your wife feel about your new back?
She loves it because she knows I've been dealing with pain and depression. It's a hard thing to deal with. You know, it almost took my life. But like I said, with my belief in our Father and His Son, Jesus, has kept me here.
Amen.
And she's a big part of that. You know, I got to thank my friends like Dave Bowden, Dan Arnold, and Brad Russell. Those are truly my childhood friends that never gave up on me. People judge me on how I look, not how I am. And I'm a very compassionate person like yourself, and I want to help other people. I can't suggest Dr. Duke and his team here are world-renowned, outstanding, and everyone's so kind. I'm just so happy, you know, to have you on my side, and I can't thank you enough. You know, thank you, sir.
Praise God.
Amen.
And thank you for having faith in my team and our ability to help you.
Yeah, it is. It's they're, like I said, they're world-class people here. You can't go wrong. At least for myself, I'm just ecstatic. It's, you know, can't put it into words when you have no pain. I love it, and I'm just so glad that everyone helped me who was involved with me getting here, because I didn't do it on my own. I thank you all.
Well, thank you for sharing your story. I know it means a lot to people out there. We just want people to know that we can now fix back pain, neck pain. They just have to come here to Duke Spine and get the right treatment done, and we'll help them tremendously. Enjoy your travels home.
Yep.
And enjoy your new back.
And I shall. Thank you so much.
Yes, sir. It's my pleasure. All right. I'm here with one of my post-op patients. We get a lot of requests for Dr. Duke. Can you show us a patient that had the surgery several weeks ago? Well, here's one. She had the Duke laser disc repair done at L3-4, L4-5. You were having back and leg symptoms before surgery. How are you doing today?
I have no pain today. I have no pain today. I suffered for such a long time. The leg pain was there for a good close to 3 years. I got to where I could hardly do anything. I'm normally an Energizer bunny. I'm always busy doing something all day long. It terribly curtailed my life. I couldn't hardly do anything without being in pain. And for a long time, I had to push through some just to do normal things, just to get me ready for the day. Now, it's gone.
Amen.
It's gone.
Now, you had your surgery done here at Duke Spine Institute in Florida in between two massive hurricanes, right?
Yes.
We had Milton recently, and before that we had Helene. And you had your surgeries smack in the middle of those two, between those two hurricanes.
Yes.
What brought you to Duke Spine Institute?
Well, my husband always trying to find something to help me. He did his research, and online we found you. So we came to see what you offered and what could be done. The other doctors wanted to fuse my back and L5 all the way to my tailbone, and I didn't want that. I was afraid of that. I had done decompression surgery at L3, 4, 4, 5. Within a few weeks after having that done, I was right back in the same pain.
We tell people about laminectomy. You had a laminectomy, it
Yes.
didn't work. I tell people avoid laminectomies. They're removing bones and ligaments out of the spine. It's very invasive, bloody, and damaging. But the laser surgery you had with us, we went in with a small, tiny Band-Aid incision.
Yes.
Outpatient, there was no bleeding.
And no pain from the surgery.
No pain from the surgery.
Wow.
Right?
I couldn't believe it. I'm like, you gave me a prescription for muscle relaxants, and I'm like, no pain surgery? I called to make sure. Are you sure? Because I don't have a drawer full of pain pills because I don't believe in them, but I know I need them for surgery. I needed them when I had my decompression surgery. I needed them when I had emergency cervical surgery, and I had no pain, no surgical pain.
Yes, our procedure is so
Wow.
gentle that there's no surgical pain and you don't need to take painkillers.
No,
Amazing. Well, thank you for sharing your story with us. And you've been through so much, and you're in my prayers. I hope you do very well. Enjoy life.
Thank you. I so appreciate the prayers.
You're welcome. Dr. Dumajan. I'm here with one of my lovely patients who came to Duke Spine Institute with a problem with his lower back. I can tell you he's had a laminectomy before. It didn't work. He looked us up, came here yesterday, had the Duke laser disc repair. We fixed 5 areas on his discs. And how are you doing today?
I'm very emotional. I got home yesterday and the sunset was behind me, and my wife took a picture of me thanking God for what happened to me yesterday. I've had back pain since 1973. I got hurt in the Army, putting helicopter blades back on a helicopter. I lived with it for over 50 years, pain. 3 years ago, the VA decided to cut 3 bones off my spine. I've been unstable and on a walker ever since. My life has deteriorated immensely. I was 208 pounds 3 years ago. I'm barely 200 pounds now, and it's not because I wanted to lose the weight. All my muscle is gone because of what happened before.
And did the VA surgery fix your problem?
It made it worse.
That was a laminectomy.
That, when they cut the bones off my spine, whatever you call it. But the thing about it is that after...
Okay, we had to end the testimonial. I'm here now. I've just finished seeing the next couple of patients we're going to do surgery on. Our next patient has a torn muscle in her buttock called piriformis syndrome. We'll be doing her surgery in another room, so we can't video and show you guys, but I'm just letting you know that's next. The patient after this one is a Russian patient. He's a scientist, and he's actually quite an interesting guy. I can't give away too much information. I don't want to give away his identity, but he, anyway, I'll just say that I think it's okay to say he's a safecracker, all right? He's truly a safecracker. That's all I can say. And that he's on the right side of the law. Let's put it that way. So many of you know that our government and banks hire safecrackers and code crackers to help them catch the real bad guys, and that's what he is. So he'll be the next surgery you watch. I can't tell you anything else other than that. And he just reminded me about a movie, and I actually told him about this movie. It's called Army of Thieves, and it's part of a 2-movie series, Army of Darkness, Army of Thieves. In that movie, Army of Thieves, there's a character that plays a safecracker, and it's a great movie if you haven't seen it. It's on, I think it was on Netflix. Yeah, it's on Netflix, yeah. Army of Thieves. So he was asking me the name of the movie because I've watched it a couple of times, and I was just reminded of that now. So I thought I'd share that with you guys. So, but he'll be a 1-level Duke laser disc repair, L2-3. And then we're going to do the Duke plasma rhizotomy, both sides, L2 to S1. And then we're going to do a piriformis release. So we'll break up his surgery into 3 streams. Okay? That'll be the next surgery you guys watch. Now, one of our viewers asked about spinal cord stimulator. They said they had a Medtronic stimulator put in, top of the line, and that it's not working. This is a big news flash. Big red alert. Folks, you must understand what I've been saying for years. These implants, like the stimulators, the screws and rods that we're putting into people's necks, the metal plates that are being put in for fusion, plastic discs, disc replacement, fusion, all this hardware, including stimulators, everything that's manufactured by the spinal device manufacturers is a huge scam, all right? A huge scam, including spinal cord stimulators. Here's why. Those spinal cord stimulators are a small little, it looks like a pacemaker battery connected to a wire that goes under your spinal cord. The entire device costs about $300 to manufacture overseas and bring to the United States to sterilize, package, and get it ready for distribution. It is not expensive. And yet, though it costs about $300 to make, they sell them for $25,000 to $45,000 each. If you had a business where you made something for $300 and sold it for $40,000, tell me you wouldn't want more business, right? Who wouldn't? The problem is these devices don't work. They've manipulated the data in the science to show studies where they show that they work when they really don't work. Okay, we've been putting in stimulators for 18 years. They were originally for patients with severe diabetes that had numbness and tingling and burning in their feet. That's why you're supposed to put them in. But here's what happened. There's only about 30,000 of those a year in the United States. So the companies that made the stimulators said, how can we sell more? Oh, let's not just put it in patients with diabetes and burning in their legs. Let's put it in people with pinched nerves and burning in their legs. And so they expanded the indications. Now, you would think the doctors who are supposed to be protecting the patients from unnecessary surgeries that don't work, you would think the doctors would say, hold on now, we can't just do that. Let's look at the science and make sure that these things work. And guess what? There were doctors who did that. And guess what the companies did? They said, doctor, you're so insightful. How would you like to work for us? We'll pay you $1 million to be our consultant. Of course, what they're really doing is they're buying up the opposition. So they bought up the thought leaders, the people, the doctors and surgeons that said, wait a second, does this really help patients? They bought them up, made them consultants, and now those doctors are now selling the devices as well for them. So the patient has zero advocates, zero truth-saying, honest people looking after their interests. The hospitals want you to get stimulators because they make a bundle. I mean, literally, they make probably $50,000, $60,000. The surgeons and pain management doctors want you to get the stimulators because they're making $10,000 profit. The company that sells them is making $25,000 profit. Everyone is making thousands and thousands of dollars on every spinal cord stimulator going into the patient, but the patients are not benefiting because they don't work. And when they do work with the trial, it's usually because they stuck some steroids in there when they put the trial lead in so that you would get an effect of, wow, I feel better. So that they can write you got better so that the insurance company will pay for it. It is a scam. I thought we did a spine scam on this. We did a spine scam on this like a year ago or 2 years ago. Spinal cord stimulators, they are a freaking scam. And yet doctors, implant companies, device manufacturers that are making these, Boston Scientific, Medtronic, they're all pushing hard for the doctors to recommend them to patients and put them in people. I am trying to raise the alarm, raise awareness. It is a scam. It's all about profits. They don't give a damn about you. You are not going to get better long term with these stimulators. They're full of shit. It's a marketing ploy. That's why we don't do them at Duke Spine. We only do about 2 or 3 a year for people with literally horrible neuropathy that can't be cured with anything else. The stimulators, their only hope, and it's a 50-50. All right? So we're seeing an explosion in putting in stimulators in patients because patients are led to believe by their doctors and the companies manufacturing and marketing these stimulators that they can help them, but they can't help you. They're a bad idea. So stay away from them, in my opinion. Any other questions?
There are no current questions. I was just trying to find the spinal cords.
Yeah, thanks for joining us. Basically, have a great day. We'll be back in 30 minutes for our next surgery.